Hello. This is a group presentation discussing to the patient the importance of the implementation of an electronic health record. The objective of this presentation is to provide to patients a better understanding of electronic health records and their benefits. So let's first go over a few definitions. What is an electronic health record, also known as EHR? An electronic health record is simply a digital version of a patient's paper chart. They contain the same records as your paper files, such as your health information, history of your diseases, and which medications you are taking. Let's also talk about Health Information Exchange, also known as HIE. Health Information Exchange is the electronic transfer of healthcare information among institutes and organizations according to national guidelines. So why should we adopt an EHR? Through research, we truly believe that EHRs provides more advantages and improvements to healthcare than that of paper records. EHRs reduce paperwork, get your information accurately into the hands of people who need it, help your doctors coordinate your care and protect your safety. EHRs reduce unnecessary tests and procedures. This can be in the case of when you have multiple doctors and teams assigned to your treatment team. EHRs will help prevent duplicate labs and studies. EHRs also give you direct access to your health records. Some other reasons to implement an EHR: EHRs can also change the way we address the health of our communities and our nation. It does this by identifying safety problems such as those related to unsafe drugs or medical devices, detecting epidemics and implementing corrective actions to protect the public, and also improves overall health care with better access to research and treatment. No more days like this. Here are some statistics. A national survey of healthcare providers reveals vital evidence supporting the use of EHR. 94% of providers acknowledge that EHR makes records quickly obtainable at point of care. 88% reported that EHR yields clinical advantages for their practices. 75% of providers testified that EHR allows them to provide superior care to their patients. When our organization implements an EHR system and connects it to an HIE, you might ask, how will this implementation affect you as the patient? Ideally, the adoption of an EHR and HIE would drastically improve the health care and safety of patients. EHRs have the capabilities of improving the relationship and communication between the patient and other healthcare providers. The consistency and availability of health records allows clinicians to make effective decisions and deliver superior care. Its accessibility to a patient's complete health information allows physicians to diagnose more quickly. A physician will be able to access records from other institutes and be informed of your previous diagnosis, problems, and complications from past visits. EHRs also help reduce errors and improve safety. An example of this could be by alarming the nurse of wrong medications or dosages during med pass, or alerting the physician about allergies, drug interactions, or contraindications. What changes you might expect as a patient within our facility? You will notice updated high-speed computers will be available in every room. While at the bedside, this will allow your nurse to have quick access to your chart to answer any questions you might have, such as recent lab results. This will prevent the nurse from having to leave your room, grab a paper chart, and in the process getting distracted by issues or other patients. It will also allow for a more convenient and safe med pass. Physicians will have portable access to EHR via computer or other mobile devices with required capabilities, whether at home or office. For example, if you're having some pain and your physician has left the hospital for the day, he or she will be able to quickly access your chart online and prescribe you something rather than a nurse taking a telephone verbal order, which could possibly lead to medical errors. Patients will also have access to their own accounts in Patient Portal. I spoke earlier about Healthcare Information Exchange, which is HIE. Patient portals can truly connect patients directly to their care, which is the true reason behind HIE. A patient portal is an online tool that develops a more direct relationship between patients and their provider. By using a secure username and password, the patient will have access to his or her portal via the web. This will give the patient the opportunity to become more involved in their care and treatment and protect the privacy and security of that patient. Patient Portal satisfies patients with its ease of use. Patients are able to set up appointments, ask questions to their provider by email, and access lab results and other tests as well as other health information online. Patient reminders. It identifies patients who should receive reminder for follow-up care and are available by emails, text messaging, or phone call as preferred by each patient. More information about patient portals. Provide clinical summaries to patients in each visit. Prescriptions can be faxed to patients' pharmacies, saving valuable time. And patients are also able to view statements and pay securely online. This concludes the end of our presentation. Thank you for listening.